Hello and welcome to 20 Minutes on Dawn English. I'm Nadia Naqi with you. Important people from important organizations that have been helping these people, the flood affectees.
The challenges that we are facing is not only our in delivering services or logistics, but also we have so many issues facing by the local politicians and the lords who are ruling these areas that yes, give your donations to us, we will in fact the political parties, they create problems like during these distribution process.
Okay, Jalila, I'm so sorry to interrupt you, but you've raised very important points. Number one, you said that local politicians are making it difficult for you to work, or they demand that it should be, the relief should be given to them, and they're going to distribute. Is that right?
In fact, they like creating so much problem that we feel that we shouldn't come to this place. People, the people who are like very graceful people, they feel shy to ask for relief things. Even their homes are demolished, they are living in abject condition.
Is the government of Balochistan not helping out in terms of, because if the local politicians are asking for help from you, so are they not having a coordinated efforts, because a lot of relief is being sent by other countries also. So I'm sure that government of Balochistan should have by now organized how they're going to distribute these relief goods in different areas of Balochistan.
That is so unfortunate. We have covered the Noshki, we have reached out to some places of Nasirabad, Jafarabad, we have reached to some places of Dera Bukti, and then Pashtun Bell like Musa Khel or Muslim Bagh. People say that they did not see any government aid agency or someone come help them out. In fact, even we did not see, in my personal experience, we did not see any international organization working on ground and support people. I don't know how this coordination of, but individuals are doing, like Balochistan Youth Action Committee, Koita Online, and there is Peaceful Balochistan. There are organizations that they are working, but we don't see government, because it's beyond the power of an individual to work for.
It's also beyond, Jalila, it's also beyond the power of even individual organizations, humanitarian, to reach out to so many people, because the devastation or the disaster.
Because of the tribal norms, especially women, they deny that we are not going to take your relief because you are taking our photos, and we request them that we are not going to upload it on social media or somewhere else. Then they ask us that if you are not uploading it on social media or other places, why you are taking our pictures? So these are the problems that we are.
A very valid point. A very valid point. Let me just rope in Mr. Shahid. Would you like to please tell us that is your reach out also in areas of Balochistan, and the challenges that Jalila is facing as part of an organization? Do you face the same kind of challenges?
I think she was quite right, and she has mentioned all these things, that accessibility is the main issue in this disaster. We have been working with many disasters in the last 20 years, and I have been part of the relief operation of earthquake 2005 and the great floods, they call it, the 2010. The major challenge that we are facing this time is the accessibility in Balochistan especially, and even in rural Sindh as well. The resources are drained out in this relief phase, then we all will have no funds or resources for the rehabilitation, which should be the main thing in our planning. We have to provide shelter to the people so that they can settle down. Once they settle down and the flood water flushed out, then organizations, the UN and all these things will start thinking about the rehabilitation. Is that the waterborne diseases? Like yesterday, I was going through data from our medical camps. We have already organized more than 300 medical camps in Sindh and Balochistan and South Punjab. And the waterborne diseases are alarming. Like if we couldn't prevent that, it will be another disaster.
So can we prevent it? The question is, can the government and humanitarian organizations are there to provide relief, right? They can set up a medical camp, they can provide with doctors, with medical help. but they can't prevent the disease. For that, you need the water to be flushed out and probably sprays, especially dengue is on the rise.
We all should work what we can do and what is in our capacity. So awareness can be created that will focus on women issues and all these things that women need. So women and children are the worst victim of this disaster.
What is SRSO? Because you're also providing a lot of relief. Do you also feel that, this phase has to be done as fast as possible to get into recovery, or you think this is not, this is far from reaching the recovery phase because the accessibility issue that both of these people mentioned basically restricts to enter the second phase of this?
Vulnerability and poverty are both sisters. They are sisters, and deeper the impact of any disaster like the current calamity which has hit us out of nowhere, first the rains, then the floods. This has also exposed the governance deficit of preparedness. There has to be a people-centric approach and outreach. It cannot be viewed with one single lens as a relief, as it has impacted health, it has impacted education, it has impacted Watson, it has impacted agriculture, and with all these things, it has impacted the overall economy of Pakistan. And all the areas, especially the riverine areas, Sindh is something which is the drain out of all the water which comes from the northern areas, from the glacier melting, from the climate change, whatever you say, it all ends up in Sindh.
And Sindh appears like a lake right now. I mean, you see the aerial view. It's water everywhere.
It's a big lake. Sarso has been doing these work, poverty reduction work, poverty alleviation work since 2003. I have been with the organizations since that time. We have the best part which we could say that our previous work has always supported in these type of times is this, that we organize communities on community level, community organizations, then village organizations, then local support organizations. So we actually are working with more than 1.1 million households in Sindh. Now, this 15 districts started from Kashmir till Badin, where the delta is and the water goes down to the sea. We are working in all 15 these districts which are affected both on the right bank and both on the left bank. Okay. It's a huge lake. The accessibility is the biggest problem at the moment.
Accessibility, you're talking about accessibility. You're saying, Aazar, that you're still in the rescue phase. So are you trying to say that not all people who have been hit by these floods, different organizations, including the local administration, the government, and everyone have actually reached to these people? So we don't know how they are living. We don't know whether they have enough food to survive. We don't know what their conditions are.
Yes, of course. There are people who even refuse to move from certain places. They have gone to a higher level on the roads, on the bunks, but they have 2 or 3 multiple problems, which you can say challenges for those people also. One thing is this, that how many boats were available and how many boats are available. Till the Army and Navy has come in, there were no boats at the district level. There are no boats. And all this area, people are now using the private boats to come to any place. They come on the land which is a little bit higher, where some activity from Khidmat, JDC, I'm talking about Sindh, and in Balochistan, there is a little bit different situation because Balochistan, it's rainwater and the floods have come due to rainwater. Here is the rain, it is the floods which are coming from glacier melting. It is the floods which are coming from the rains which have happened in the northern part of this country. All that drainage is down in Sindh.
Okay.
Shahid is going to second me on that the reaching to people who are sitting inside and there is no boat, nothing at all where you can go. They are going by boats They are going by foot and taking all those rations and everything. And I think Al Khidmat is also facing that kind of a problem.
Right.
So that is there. And on top of that, now those who have come to the camps, where are the camps? What are the distances between? The relief is happening. The rescue is happening. How far are the camps? According to UNFPA, I will highlight one basic point, which is like for women. UNFPA has just assessed that there are 138,000 pregnant women who are there either in the camps or on the higher areas, and 43,000 births are expected in September 2022.
Yes, Aazar had shared this with me, and this is a huge number. This is a huge number, and I'm sure that even Balochistan is facing the same problem. But last comments from all of you. I'll start from you, Jalila. Do you think there is still what is missing is probably a centralized system of relief and accessibility, and how to go about it for individuals, for civil society members, for organizations, coupled with governments, and there is a need for it? Or do you think, no, there is no need? It'll create more hurdles. It's better that, we know the area. We should just go and start doing whatever and wherever we can reach.
What I personally felt during this relief work is we need an organized system like a mobile app or something, map tagging that if a specific group deliver food, they mention that yes, we have delivered food, they need tents, the approximate number of people is this. So it will help other organizations to, collaborate accordingly. In this era of tech, I don't know how we are working manually, like writing the phone numbers and CNIC numbers and all these things, because it's very difficult for us. One other thing I'd like to suggest that especially in Balochistan, we request all female doctors should come to every part, from whichever part of Pakistan they get accessibility, they come, because there are so many women who are expecting, and next month, as Dr. Saab mentioned, that they are expecting to deliver their babies. So what we need is immediate female doctors who can help these women during their deliveries, because Balochistan is already high in the mother mortality rate during deliveries. So we really need, it is an immediate need for the basic health support of these women.
Shahid, do you agree with an organized system of distributing and reaching out to people who have been hit by this disaster, as Jalila suggested, some app or some place where everyone can, just put in the data record and say that, this is the place we've done it. Now we're moving forward, and these are the requirements now in a particular area.
There is a great major effort on that, and Park Launch, it's a organization that has been founded by the old nurse students all around the world, and there is they have formed a few groups. We are part of them. We are engaged with them. They are not only mapping all these relief activities, they are mapping the medical sites, medical camps, the water sources, the road infrastructure. So I think that it's a good initiative, and it should have been an awareness among all the stakeholders regarding that. NDMA and the relief web that they have made, it's also one source of information. But I will come to the point about the issues of mothers and the thing that there are pregnant women. We are deploying specialized mobile health units from Monday onwards, and we hope that we will get it number to 15 at least, and it will go to the areas of Sindh and Balochistan, although our medical camp infrastructure is there. But additionally, we are deploying 5 to 6 field hospitals for next 6 months. Water is a major thing. And for the last 2 weeks, we were wondering, although we have some experience in that, but the thing is that movement was quite limited, and our initial mobile water plants were quite heavy. So now we have come up with a lighter model of that, and 10 units will be deployed in this week, inshallah, and we are going to raise that numbers to 50, and it will start giving clean water in the affected areas, and they can be moved from one village to another, and it is in lighter veins.
Aazar, where are the doctors that were already working in Balochistan and Sindh? And I do understand that the field hospitals are also underwater. And, Azra Bechu Saiba had said that, they're trying to just bring them on and flush out that water, dewater those already existing infrastructure. But where are the doctors? Where are they? And where is the government on this?
The basic problem at the moment, which is going to arise in a few days' time, which will be the dewatering. That is one issue which we have to deal with in the recovery phase. At the moment, what we are doing, since we have been working for the last 18, 19 years in these areas, and we have got a very good coordination with the district governments. We work with for the government People's Poverty Reduction Program in Sindh. We are implementing, because we are part of the RSPN network, the Rural Support Program Network. So with NRSPs doing certain districts, DRDP is doing certain districts, we are doing 9 districts. And since we work very coordinated efforts with the district government, so we are quite well placed in that manner in coordinating with the district government. So most of the efforts are in that manner. The second thing is that since the communities are organized by us and our social organizers, so we have got an access, we know the exact locations, we know exact how many people, what are the problems, already existing problems, and now how they have been multiplied. So the only thing which I see is this, that and on top of that, I think there is always PDMA. When PDMA was formed in Sindh and in every province, a district disaster management plan was made. A district disaster management authority was made. So that plan, those plans should have been very integrated, should have been with an integrated approach, should have devised a certain level. How they are, I have not gone through that, so I cannot pass a statement that.
Right.
But the major thing which I see now is the coordination between all the stakeholders who are working in the field. One. The second thing is coordination.
And, like Jalila said, and so are you saying, a coordinated effort makes it easy for all the organizations to then reach out to areas probably where nobody has gone. And also, what are the requirements? Maybe, your organization is providing water, the other is, providing doctors, the third, like Jalila, is doing relief goods. So do you not think that, did all of you or other organization speak to the government or probably the NDMA or the PDMA that we need that centralized system so that a duplicate is not there, and everybody can get what is required?
The major thing is required is a cross-sectoral based integrated approach. One thing is that which we have to see in these kind of catastrophic calamities, the solution lies in an integrated cross-sectoral approach where all adaptive measures we can take, from coordination to the delivery plans. Right. Because I strongly believe in not creating parallel structures. I strongly believe in strengthening the on-ground things, especially the government. People will come, governments will come, everything, we will come and go. But those structures are there. So best thing is to coordinate with district. All people who are working in that particular district should approach and then sit and decide, okay, this area you do this thing, this area you do this thing. Overlapping and duplication is wastage.
Absolutely.
Lot of food has been wasted. Lot of things. As far as the drinking water is concerned, that is major thing. But there is a very simple solution. There is a aqua tap which is of 6 rupees and which purifies 20 liters of water. So 20 liters of water, one day is more than enough consumption for 5 to 6 people. So 6 rupees you give that particular household. We are doing that. The other thing is there is one tablet of 21 rupees. These are the discounted rates we are getting from the market, and that can purify 500 liters of water.
Okay.
If it's a turbid water, 2 tablets, put 2 tablets in 500 liters. Al Khidmat can do, because if you have got Bowsers, you have got things. This is the initial thing you can go and give it. We are including it into the rations. We are including into the this women dignity kits, which we are trying to do in
exactly. And because our we're just finishing now. We just have a minute left. Jalila, you have raised about the doctors. Just unmute yourself. You've heard about how to provide clean drinking water. Would you require any help from all the people that we have on board, or would you like to send some message that probably it reaches to the right?
Everyone mentioned that we need clean drinking water, because our water are contaminated, and then I live in Quetta. I fell sick, so I don't know what really is happening in the peripheries.
Right.
We also need immediate doctors from our Pakistan, means they should give their preference to Balochistan, and as well as we need immediate tents, because most of the people are still homeless. We need to relocate population who are living next to the dams to a safer place, because now the winter floods and rainfall starts. So I think they are more in a more vulnerable condition in coming future.
Well, thank you so much. Unfortunately, our time is over, but we shall definitely keep on asking where the relief and the rescue efforts are reaching, and have we entered the recovery phase? We really hope that we do. And as Jalila mentioned, as Dr. Saab mentioned, as Shahid Saab mentioned, there is a dearth of doctors, and for females, doctors are required ASAP, for children, for the old, and it's not easy. To sum up, I'd like to say that in a disaster hit area and of a magnitude that Pakistan has faced, it really is not possible to reach out 100% to those who have been affected. However, there are other things that have been highlighted today, a centralized mechanism, so that everybody you could reach out to the maximum people to provide the rescue relief efforts. And as soon as the water recedes, the next phase is going to be as tougher as the first one, and that is to recover from this and then to rehabilitate. We'll keep an eye on this. That's all for today from Dawn News English. This is Nadia Naqi. Allah Hafiz.